Hi, my name is Dehra McGuire, and I'm a laryngologist at Warren Clinic. A laryngologist is a type of ear, nose, and throat doctor that has done special training in voice, airway, and swallowing disorders. I'm actually the first doctor in my family. I went to high school here in Tulsa and graduated from Metro Christian Academy, and I was taking anatomy and physiology in my junior year, and I thought, man, I would really like to do something like this. And so that was kind of the beginning of my journey. And I was pre-med all the way through college and then got into the University of Oklahoma for medical school. So laryngology is more of a broad field than just voice. When I went into it, I certainly thought that it was predominantly voice, but it's really so much more broad than that. If you think about people who use their voice all day, it's lawyers, it's teachers, it's people who are in marketing, working telephones. I mean, I see a really broad population because we all use our voice all day, every day. And so it's people who have hoarseness from that, but I also see things like people who can't breathe very well because they have scarring near their airway, or people with chronic cough who have been sick and have this perpetual tickle in their throat, or people who have trouble swallowing. I also see people with smoking history. I treat dysplasia of the vocal cords, so abnormal cells that potentially could turn into cancer. I also treat cancer of the vocal cords, and also just chronic changes from smoking that have caused people's voices to change. We see that predominantly in women. They start to have a lower voice, and so sometimes these changes can become so large that people have trouble breathing and they have to be taken to surgery, so that's a surgery that I do as well. My philosophy of patient care, I think, is highly collaborative. I share the voice box and the airway with both anesthesiology and cardiothoracic surgery. I share the esophagus with GI doctors. I work closely with speech-language pathologists, and so my philosophy, I think, is to really look at the whole patient and make sure that we're really getting to the bottom of the issue. And if that means working with other providers, I really take all of those notes into account and all of those perspectives into account when I approach patient care. And I do love working with patients to find a plan that is reasonable for them and fits into their lives and really improves the quality of their life. Because I'm one of only 2 laryngologists in the state of Oklahoma, my passion is definitely about bringing those laryngology services to northeastern Oklahoma, because I don't want patients to have to drive up to Kansas City or to Oklahoma City or down to Dallas or wherever to get this type of care. And so I'm really trying to keep my schedule open for those patients who haven't had this service available for them before, when there are a lot of general ENTs in the area. So if you are someone who has had hoarseness, or just a singer that wants to get a checkup, or someone who's had trouble breathing or trouble swallowing or pain in your throat and nobody's been able to get to the bottom of it for you, I would love to see you in my clinic.